Have you ever wondered what it's like to live with more than one identity inside you? This is the reality for individuals with dissociative identity disorder, or DID. Often misunderstood and stigmatized, DID is a complex mental health condition that can deeply impact a person's life. Dissociative identity disorder, previously known as multiple personality disorder, is characterized by the presence of two or more distinct personality states or identities within an individual. These identities, or alters, can have their own patterns of behavior, thoughts, and emotions. They may even have distinct names, ages, or genders. One identity usually takes control at a time, with switches often triggered by stress or trauma reminders. But what causes DID? The condition often develops as a coping mechanism in response to severe trauma. Usually this trauma occurs in early childhood, a time when the child's personality and sense of self are still developing. The child dissociates or disconnects from the painful experience, leading to the formation of separate identities. Understanding DID is the first step in reducing the stigma and misconceptions that surround it. Many people may hold false beliefs about DID, often influenced by sensationalized media portrayals. But it's important to remember that DID is a real and serious condition, not a form of attention-seeking or faking. Treatment for DID often involves a combination of psychotherapy, medication, and self-care practices. Psychotherapy, or talk therapy, aims to help the person understand and manage their symptoms, cope with past trauma, and improve their relationships. While there's no specific medication for DID, doctors may prescribe drugs to manage associated symptoms like anxiety or depression. DID is a complex, multifaceted disorder that can be challenging to live with. But with the right support and understanding, individuals with DID can lead fulfilling, productive lives. In summary, dissociative identity disorder is a condition characterized by the presence of two or more distinct identities within an individual. It often develops as a response to severe trauma in childhood and is associated with significant stigma and misunderstanding. Treatment typically involves a combination of psychotherapy, medication, and self-care practices. So the next time you hear about dissociative identity disorder, remember the facts. Remember that it's a real, valid condition that affects real people. And remember that understanding and empathy can make a world of difference to those living with DID.